Livable Communities Conference. I'm Dee Chantel, and I'm going to be your facilitator for this breakout session. We have Kate Rogers joining us. She will be our scribe. Give us a wave, Kate. And we also have Rita Hubbard Robinson. She's going to join in and help us move the conversation along as one of the community health experts. So we're happy to have her here today. So far, this has been an amazing conversation. The conference has been enlightening for me, I know. But before we begin this breakout session, let's discuss a few ground rules. We are looking forward to a robust conversation. If you would like to speak, please raise your hand. You can find that down below within the chat section. You will be acknowledged to and announced to speak, and you can lower your hand once you've been acknowledged. Please remember to unmute yourself when speaking and put the mute back on once you're done. Thank you. So we are going to begin our conversation. It's going to be centered around COVID-19 on healthcare and the impact that it has had on our community. Given COVID-19's impact, we're going to discuss what have we learned about healthcare access. We're going to center our questions around home care, dialysis services, hospitalization, and primary care specialty and nursing home care. Just to give a little context around that, I will add that my mother actually experienced some problems during the COVID-19 where I wasn't able to go into immediate care with her. And that was a different experience for me. But actually, before we begin that, the discussion around this, can we give a little brief introduction of who we have within this breakout session and actually what attracted you to come in on the healthcare discussion? So I will say, anyone just raise your hand, unmute, or unmute and join in. Everyone can unmute. Or yep, just place it in the chat. How about that?
I was going to say, it sounds like that might be easier.
Yeah. Yeah, if you're here, just place it in the chat. Go ahead and place it in the chat. So it looks like our screen changed. Okay, so to start the conversation, has anyone experienced any, what has been your experience since COVID-19? Any experiences with healthcare, hospitalization, nursing home, dialysis? It may not have been you, maybe a family member.
I'd like to raise my hand.
Okay.
And I think everybody here has just been overwhelmed with COVID-19. We're hearing it all the time in every venue. When you turn the news on, there's something else about COVID-19. And it's been impacting certainly our mental health and other things. But one of the things that I think about is, for example, you have here dialysis services, that we know that there are people who are in a room for all day and half the night receiving these services. Wouldn't it be wonderful to have these services in homes, in your home where your family is, and not necessarily be aside strangers for a number of hours. And then you have this pandemic, and it is an infectious disease, and you're in the sort of ward situation receiving dialysis. What can we do, or what should we be doing to change those things? I think and certainly your experience, Dee Chantel, with your own mom and not being able to see your mom or see about your mom while she was in healthcare. I think that this is where we want to probably talk amongst ourselves.
Yeah, actually, I was just going to give that as an example, maybe to see if anyone else had some information, but let me kind of provide more information about my experience and tell you what it was like. Maybe other people can chime in and maybe provide input or what do you think we can do better to change that? So my mother, she actually works in Niagara County Jail, and she does like side counseling, right? So she lifted up a bottle of water at her second job, which no benefits, no nothing, right? It's very on the weekend, she just picks it up sometimes. So when she lifted the bottle of water, she hit, it must have pinched a nerve, right? So she became bedridden. She goes to get adjusted. And that same day that she went to a chiropractor to get adjusted, around 1 o'clock in the morning, she lost all feeling in her legs that started at her feet. It went all the way up. She said she can feel it in her chest. She was nonverbal. And my mother's very healthy, very live woman. And to get her out the house, we wind up having, she lived in an upstairs apartment. My sister lives downstairs. We wind up having to call the ambulance to get her out the house. She was rushed to ECMC. They did blood work, everything, nothing came back. Everything was fine, right? She wound up having to come home with a cane. They gave her a cane. From that moment, she just stayed on the couch. She couldn't move. She was actually, she couldn't even get up and go to the bathroom. She had a bedpan. And she was like that for a week. She did not look like herself. She was barely talking. She was sitting up, falling asleep. She could no longer drive. And there was no way she could get into immediate care as a follow-up visit, a comp visit from her other job. This is the access that they provide her to go to immediate care. So not only did she have to be driven, she had to be kind of walked in, but at her barely standing, she was unable to even like sit up herself. So to not be able to assist her further once she's in urgent care was kind of, it made me nervous, right? Because I'm like, I don't know if, yes, it's a healthcare facility, but just putting that care in someone else's hands and me not being able to see my mother like all the way through was very, very hard. So I understand the importance of restricting access and not letting someone else in, just letting the person being seen. But in some cases, you know, you really have to bend a little bit. There needs to be additional amendments to those policies when someone needs additional care. So that was basically my experience and the impact that COVID-19 has had on specialty care, you know, urgent care for me. Alexa?
Hello, good afternoon, everyone. Pleasure to be here. One experience that I've had, which is not, it's kind of directly related to COVID. I don't have the answer for it, but my mother was due to have major surgery, not major, but for her hip replacement. And it was outpatient, and she's in extreme pain every day, you know, and she doesn't have pain pills that can manage and assist her with this pain. And because of the recent designation to orange zone, her surgery was postponed. We understand why. We understand that it's not life-threatening in relation to COVID, but in terms of a personal experience, that's painful. That's life-threatening, essentially. That's what you're feeling. So how do you balance that? We know we don't have enough beds for even the COVID patients. And I just read that today we have the highest number of hospitalizations since the very beginning of this pandemic. But how do you help the people that really, 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 really need help, but they're not experiencing the COVID issues and pain? So I don't have anything to add, but you know, it's definitely, everyone's feeling it outside of COVID. So that added stress, the stress of not being able to go into the hospital with her, the added stress of taking extra tests to make sure that when she does have her surgery, that we can be with her and we can help her through her recovery. Those are really tough.
Thank you for that additional input. That was great example. So I would say, to summarize that, there needs to be some updates to policy changes. We don't necessarily know what it is or how we can go around that, but I think um, from both Alexa and my experience, we can see that there needs to be updates to those policies around COVID-19 and assisting family members who may need help. Okay, great. Hi, Ms. Grant.
Hi.
Yes.
So, I empathize with both of you in terms of what you're going through personally. It can be very stressful because I dealt with an aunt living in South Carolina who was in a facility who I wanted to move up here, but because she's so used to being in South Carolina, she didn't want to do that. But this was pre-COVID, so I mean, having COVID layered on all these issues is even more traumatic. But the concern that I have specifically is regarding the folks that are in residential facilities, nursing homes, any level of care there, and what I'm calling a pandemic of depression and isolation that's going on with the residents within the facilities. There are not enough behavioral health workers to deal with these folks individually. They're missing their families. The families can't see them. Sometimes they're out of town. Um, you know, going, you know, going up to a glass and seeing someone is obviously, secondary to holding them. But we're just finding that, and the statistics are showing in the COVID era that the depression among the general population is bad, but even more so for those residents who are in any kind of long-term or facility for our senior population. So I know every policy, every um, nursing home facility level of care may have their own individual policies about what they do in terms of trying to get behavioral health services to those residents. But I would like to see some standardization at the New York State Department of Health um, level, that there should be so many hours, just checking to see how they're doing an assessment to see how they're feeling. For those outside of the facility, I know that the AARP has been very instrumental in offering a chat line to those folks who are isolated in the community. And there are volunteers who will call seniors and ask how they're doing, what needs can we link you with in that particular community. So, I certainly continue to applaud AARP for the services they're doing. But on the policy level, I believe it needs to be more through the Department of Health for those folks who are living in a facility right now.
Thank you. Thank you for the additional input.
I would like
We're
to
going to move on to.
Can I just add a little bit, please, to what Ellen was saying, and that is that not just in nursing homes, but also in senior buildings, where there are primarily seniors living, that they are also dealing with that same kind of spirit of isolation. And how do we create services and systems to check on those? I just lost a dear friend in the community who herself was a senior, and she passed away and no one knew. They just recognized that they hadn't seen her car move in a few days, and we don't know how long she was dead. So these are the kinds of things that we know we need to certainly integrate into the way that we do business post-COVID, but just, really, if these systems were already in place, we wouldn't be trying to figure them out right now.
Okay, thank you for that. And I think that brings us to our next question, if we can put that up on the slide. So hearing those scenarios, and thank you, Ms. Rita, for adding that as well, we can see there has not been any solutions. And I like Ms. Grant recommendation on policy and innovation about standardization as well. And are there any community-based healthcare solutions to helping like check on, let's say, the seniors? I hear about things like that, but does anyone within this panel know about anything like that? Oh, great, I see things in the chat. Yes, add them in the chat. If you want to raise your hand, that would be good to know. We can add it to our notes. That's information we can put out to the community.
You see what Bill said in the chat? Yes, okay, perfect.
Yep. All right, so thank you. We'll move on to the next.
I'm sorry, I was looking for the hand. I'm not I'm
No,
technological.
go right ahead. Go right ahead.
So forgive
Don't
me.
worry.
It took me a while to serve it. By the time I find it, you're on to something else. Anyway, I was just going to say in the city, in our city government, our Department of Senior Services, we do offer a warm line volunteer call-in where we check on those seniors who we know that are in our network that we know of, calling them weekly to see how they're doing. Or the family will call us and ask us to check on. So we do provide that. And it's really a voluntary kind of thing. Unfortunately, what concerns me are those seniors who are isolated, who really are maybe a little bit paranoid. They don't want a stranger calling them to check on them, that kind of thing. So I always worry about those folks that fall outside of that bubble.
Now, I wanted to add too, I know often the disability community can teach us in this space that we know that, for example, seniors have the ability to, not lift their legs on a curb because of the requirements to have curb cuts that was led by the disability community. So, or I wondered if anyone here may have some insight on how we can create more of a close knit opportunity for our seniors specifically, or anyone who is kind of stuck in the healthcare wheel, whether it would be the seniors, disabled, dialysis patient, or other a patient that requires special services. I think that that might be a way to get us to create some learning in this space.
There was a comment from Bill McDonald. The Rochester Aging Alliance is in the process of completing a study on poverty in older adults because we believe they are overlooked and many think the safety net takes care of them. So Common Ground Health in Rochester has done study on poverty and health. So thank you for that. And he provided the link in the chat if anyone wants to access that. As well, to raise your hand, there is a participants button at the bottom of your screen. If you select that and go to the chat, the raise your hand button will be right there. But feel free to use the emoji reactions as well. I can see you. Okay, we'll go on to if no one else has anything to add. Oh, great, Jimmy Hart, Erie County Senior Advisory Board. Okay, thank you for that. We'll move on to the next question. Given COVID-19, what about the data and its use in population health strategies to improve access to health care, the health improvement maintenance and chronic health conditions? So how do you feel the data has been used throughout the community based on COVID-19? Do you feel that data has been helpful? Has it been communicated out? Do you feel like you're receiving information you need to move throughout your community? Do you feel like they're adding additional resources? Has resources in your community based on the data? Has that been shared with you? Do you have a community advocate that you can go to? But yes, the data presented has been good, very good. Can someone share a way the data that has been shared, how it has impacted your community? Or is there some resources that you see other communities receiving that you may be interested in getting in your community?
This is Rita again. I just want to kind of get us excited about this because, data can really drive policy. It can drive change, as opposed to just saying, I feel like the community needs this. We can actually look at the data to determine what neighborhoods need more help. What I know that the city has a 311 line and they use it, they're beginning to use data in such a way to determine what neighborhoods, what parts of the community here in the city of Buffalo need X, Y, and Z. So this I think could be really very helpful to us in healthcare and very helpful to improving healthcare. Thoughts?
Okay, we have a question. How is the data being used? Just reporting the data is not enough. What's being done with the data? So how is that data being used?
Well, for example, when I worked at Millennium Collaborative Care, we really allowed the data to drive the direction in which we would provide services. So, for example, we can see. I mean, there are platforms that allow you to see what areas got flu vaccinations last year, which will help inform decisions around what neighborhoods we need to be focused on to get a flu vaccine, or what neighborhoods might be more likely or less likely to get the COVID-19 vaccine. So this is just one example of how data can be used to drive change, to drive where dollars are brought. We know that health equity is not health equality. Therefore, we need ways in which we can actually determine where we should be providing the most resources to the most to the communities in most need.
I guess I'll raise this question out there. Okay, since everyone says, they're receiving data, they're comfortable with the data that they're receiving in their community, seeing that data, how comfortable are you with receiving the vaccine once it's in your community? Once it's offered to your community, are you comfortable? A yes or no in the chat. You don't have to come on and say it out loud. You can just type yes or no. Because that data is really what's going to drive what community receives the vaccination, who's going to receive the vaccination. Is it going to be the healthcare workers? Is it going to be the government? How that really drives how the rollout of that vaccination is going to come into your community. So given the data, and since we are privy to what data is out there, are you comfortable with receiving the vaccination from which you know today at this point? Even though Obama said he's going to do it live on TV. Yes, no, how do you feel? But you can pop that in the chat. I'll move on to the next question. I'm going to look for some of those answers in the chat. But that's something to think about, since we do have the data. Keep that in your mind while you're looking at the data, because that's really going to be the driver of how this vaccination is distributed throughout the community, who's going to receive it. And people with pre-existing conditions, that everyone's body's not the same, right? So we don't know how it's going to react to your body. So that's another factor you need to account for as well. So I just want to put that out there.
We have a few things in the chat. We have a not completely comfortable, and we have a if Dr. Fauci says yes, then I'm on board. I'm with you, Ellen. Me too. And once it's shown how it impacts people with similar health conditions, that will maybe give some clarification about what the effects will be among different groups and people who don't have the same pre-existing conditions.
Thank you, Kate.
Can I just add something on the?
Yeah, did you want to chat? Yeah.
Yeah, so on the vaccine discussion, I think like what you're saying about the data is important, but I think what's more important is actually the relationship building. And so for us in community health planning, what's going to be really important over the next few months is getting the right community leaders, and not even necessarily real leaders. And I don't mean that as I said it, but like informal community leaders to the table talking about what the community's hesitations are and how we can address those. So it's more than data, it's about relationships and that trust building.
Yeah. Yep. Thank you for that.
Absolutely. I think you're absolutely right with regard to making sure that people in the community are part of the solution, and that they are speaking to their members, the members of their community. And if we know where the communities are that are going to be the hardest hit, then we should be focusing our attention on those small L leaders or big L leaders to help us in those neighborhoods where we know, should the pandemic get in there, it's going to decimate a whole neighborhood. So, trust is an important factor. Data is an important factor, certainly, and messaging, and getting the word out, and truth and science is going to also be part, I think, of what we need in this space.
Okay, we have Ms. Grant, go ahead.
I'm just continuing to build on that. Yeah, I'm concerned about the fact that there doesn't appear to be a curriculum that I've seen at the state or the federal level, well, certainly not under this present administration, hopefully under Biden, where there is a rollout on how the communication, the PR campaign, we need to be hitting that on the ground right now in terms of going into the communities, the hardest hit ones, and getting the leaders of that community to get the message out. As we know, so many people of color are hesitant to do any kind of participate in any kind of study because of the syphilis study of long ago. We all know about that, but we've got to get those folks right from the ground. And I think one way to do that, there was a program about 20 years ago that I was becoming involved in, where lay coaches through the faith community, lay health coaches through the faith community were identified to give the message of, you know, whatever the health issue was at that time, to getting community engaged in the process. So I mean, that's the thing. This should have been, I mean, we're late. This should have been done like in March, this education in the community. So that's just my 2 cents and my concern and complaint about it.
I appreciate your feedback. And that actually drives us to our very last question. We did get something that came up in the chat, and this is going to bring us to our last question as well. We need representation within the healthcare system to protect us from racist doctors. Very, very good point. So actually, before I provide context on that, I'm just going to read the last question. So given the COVID-19, what is your feedback, or how do you think healthcare workers, the faith-based community, the community ministries and missions, the programs providing support, what kind of training and support and resources can they put out that may be innovative? It may not have been created yet. What do you think they can add to the community to help us feel more comfortable with vaccination, to feel more comfortable with educating the community? What do you think could be out there? I like web-based training. I think someone said that would be great. I'm going to go back to the question in the chat about doctors, and just about the treatment of patients within the healthcare facility. We know that that is a known issue. Me journeying into medicine, I'm always a believer of women who are in pain, especially Black women who are in pain. Even experiencing this with my mother, she had a horrible experience with them not believing her pain. There is spaces, I know because I'm in some of them, and sometimes I'm the only Black woman in those spaces having conversations with doctors. And it's not uncomfortable for me, but I would like to say that those conversations are being had, right? But unfortunately, there's not a lot of people who look like me who are doctors, and especially within the Buffalo community. And those who are, they're overworked. And they just might not have the capacity, right? Because they're trying to stretch themselves thin, and they can't exist in those places. So I think for me, I've made a forever pledge to my community to bring up those young people behind me to become doctors. So if I see someone who's in high school, even in college, I connect them to every single resource that I have. If I don't have a resource, then I'm gonna sit with you. I'm gonna do everything I can, from schools to whatever I can do. And I push them in those spaces, right? Because I can't be in every single room and have the conversation with people on fair treatment of Black and brown people. I just can't be there, right? So if I can bring people with me, trust me, I try, and I try hard. So
Chantel,
that's,
we have, Ellen has her hand raised. Sorry, I don't mean to cut you off.
thank you.
No, just to
And
build
there's
on,
a lot happening in the chat.
Yes,
also
good, good, good,
busy.
good.
just to build on that and what I've, what I've seen in the chat. Yes, in fact, there is a study that says that it was done of first year or second year residents, a national study of medical residents who believe still to this day that Black people have a higher pain threshold than white people. So my God, this is 2020 and we're still dealing with this. And we know that disparities, that still continues to be out there in the health profession. So that's preventing people who have real medical issues, as we know, from even seeking healthcare in the first place. So, I don't know. Certainly, we're doing a better in some areas of the country of making some sort of cultural competence training in the medical school as part of their curriculum.
Yeah,
And another route I'd like to see mandated in our school systems is introducing our kindergartners right from kindergarten to STEM, starting in STEM so that they can be introduced to issues with science, become researchers, medical physicians, etc. Because this is going to continue until we have enough of a mass of people that know about these issues and Black people's concerns about being treated equally when they go into the medical office.
yes. Thank you. Thank you for that. There was some more info in the chat. Not only doctors, but nurses and respiratory therapists. They don't have the proper days off in healthcare. So that's another issue. Yeah, they're definitely being stretched way too thin. Are there any additional resources you think we can get in the community? I like the STEM idea, actually teach STEM to young children. So if you know somebody who need it, call me. Yeah, so we are winding down. We have about 5 minutes. If you have any more questions, please pop them in the chat, raise your hand. We have about another minute for another question. This was a great conversation. So far, we discussed innovative ways, policy that we can have livable communities and solutions to stabilize the hardest hit community, which is our seniors. We talked about the data and how it impacts the communities, the Black and Brown communities, and about not only the data, but the education that needs to be around how that vaccination will impact our communities. And then just about the community healthcare workers, faith-based community, things that we can get out there, how we can help not only the seniors, but we also have to help the young. Ms. Rita says this to me all the time. I'm a lover of seniors. I love my seniors, but they're my future, right? So not only is very important that the seniors reach back to the young, but the young also reach back to the youth, right? So we have to keep that transition going. And I'll just share with you something that my friend texted me.
Chantel?
Yeah.
Rita, did you want to say something?
I want to just add, because we were talking a little bit about the healthcare worker, and there are so many people that work in hospitals and in healthcare that are not making the big money. Okay, they're home health aides, they're CNAs, they're working in the commissary, they're cleaning the floors, and then many of them have comorbidities. They're the working poor. They're seeing death and dying every day, and they don't really have the support. So I would love to see a way in which we can shore up that part of our essential workforce. Many of the bonuses that went out as a result of the long hours and shifts that were going on during the COVID period were not they were not compensated for their part in that. So I know there are others that probably can speak to this better, but I wanted to lift that as well.
Yeah.
And I
Does
think
anyone have any additional input on that?
there's one thing that Marisol said that's a little bit related to it about how there's burnout with a lot of healthcare professionals. They cited doctors specifically, but I think we could probably make this applicable to most of the people that Rita just mentioned. I think burnout, especially when advocating for things that are beyond their pay grade, can be rather difficult and can cause a lot of disenchantment with the system, if I can paraphrase for you, Marisol.
Great, thank you, Marisol. Anyone else? Feel free to add additional information in the chat. Raise your hand underneath the participation tab. Ms. Rita, as we close out, do you want to add any additional comments?
We have a raised hand from Jolanda too. Sorry.
Okay,
Good afternoon, everybody.
good afternoon.
Yeah, just really quickly. Yeah, I know there's a lot going on in healthcare as far as like representation, the representation issues, and then the burnout and like the mistreatment of healthcare workers. But I just specifically just wanted to lift up the fact that there are no real resources for patients who are mistreated by doctors and maybe nurses, but doctors typically have, I guess, quote unquote, power and a lot more authority than nurses when it comes to dismissing patients, oftentimes due to like baseless claims for baseless claims. And what happens is it puts the patient in this position, oftentimes people of color, people from marginalized communities, it leaves them without a doctor, and then in the wilderness, essentially, to now go out and try to find a new one. So within that time, what happens, right? Especially with COVID, maybe they're sick, maybe they do need to be seen, and they can't because they now have no primary care doctor. And that's like a real issue, and it happens all the time. My sister works in a healthcare office, and she says the amount of people that get dismissed from practice is a lot, is a whole lot, and they typically don't have any solutions. And I'm just wondering if there's a way to create some sort of resource, if that can come out of this conversation today for patients.
Thank you for that. We'll definitely note that within our notes, and we'll take that back. It seems like there needs to be advocates across the board. Thank you so much. We are at the end of this breakout session. I'm going to just direct everyone to the main stage. Everyone's participation has been wonderful. Thank you, Kate. Thank you, Ms. Rita. And thank you everyone for attending. If you need the link to get back to the main stage is in the chat. This conversation was great. Have a great evening.
Thanks all.
Thank you.